Good evening, everybody, and welcome to Pull Up with Limbs and Things. My name is Dr. Chanel James. I am the owner of Limbs and Things, mobile and telehealth physical therapy practice, serving aging adults in DC, in Maryland, and in Virginia, helping you move from I can't to I can. Tonight, we're talking about strokes 101, trying to give you the most information that you can possibly have to live a fulfilling life for as long as you can. So usually patients come to physical therapy. They know their diagnosis of having a stroke, but they don't tend to know all of the things about it. So physical therapists like myself end up having to describe that diagnosis to the person. So ischemic strokes, I usually describe those as roadblocks that happen in our brain, right? We've got traffic, and we're all familiar in this area with having a lot of traffic. And so in an ischemic stroke, the blood flow stops, right? That person or the other part of that person's brain is not getting the blood supply that it needs. And then with hemorrhagic strokes, that's more like an oil spill on the road. So the blood is just going everywhere that it possibly shouldn't go. We don't want our vessels to rupture because everything is supposed to stay going in the right path, just like traffic. And then you have the transient ischemic attacks, or the mini strokes, people tend to refer to them as. And those are when we have what I consider warning signs, right? And so all three of those types of strokes we'll touch on a little bit tonight. But I invited Miss Suzanne Coyle. She is the executive director of the Stroke Comeback Center. And she's going to talk to us tonight a little bit about how strokes affect us as we age and as she works with in this area. Welcome. How are you?
Great. Thank you so much for the opportunity to be here today.
All
So,
right. So tell us a little bit about yourself.
sure. So I'm a speech language pathologist or a speech therapist by training, and I spent about 20 years working primarily with stroke survivors, but also other kinds of brain injury and other neurological diseases and conditions. And about halfway through my career, I had the opportunity to work at the Stroke Comeback Center. And at that point in time, it was a very new organization. It was very small. It was just getting started as a nonprofit out in Oakton, Virginia. And so I was able to split my time working in traditional rehab and then also working at Stroke Comeback Center. And it was a really nice bridge. So many stroke survivors reach a point in their recoveries where traditional rehab is either no longer available to them or is no longer meeting their needs. And for so long, there was no place for people to go. And that's where the Stroke Comeback Center comes in. So we, as a nonprofit organization, we provide long-term services to stroke survivors for as long as they need us. And most importantly, regardless of their ability to pay. We have 3 centers now. So we've grown tremendously since those early days of the small center in Oakton. We now have 3 centers. We have one in Vienna, Virginia.
Okay.
We have one in Rockville, Maryland. And we have a virtual center. And through those 3 programs, we're able to serve stroke and brain trauma survivors throughout their recoveries. They can start with us at any point. They can come and go as they choose. And most importantly, they can work on the things that are important to them to help them get back to living an active and healthy and productive life.
That's everything that it's about, getting back
Yes,
to an active life.
absolutely.
Okay.
Yep.
So let's see. I want to make sure we put up your information because you said you guys are virtual.
We are virtual, and our virtual programs are open to anyone throughout the states of Virginia, Maryland, anywhere in Washington, D.C., and in North Carolina.
Nice. Okay. So
Yep.
if you're watching with us and you have a comment or a question you want to ask, please put it in the comment section. If you are live watching, hashtag live. If you are catching this on the replay, hashtag replay. And let's talk a little bit about all the different types of strokes. And do you see all of those at your center?
Yes, absolutely. We see all those types of strokes that you mentioned. The ischemic, the blockage, is the most common. But interestingly, when we talk about stroke with our program participants, lots of people don't know what kind of stroke they had.
Right.
Maybe they got that information in the hospital. Maybe it was a time that they were overwhelmed or unable to process that information because of their communication changes as a result of the stroke. But we have a lot of people that don't really know what kind of stroke they had or where in the brain the stroke was. So we can kind of get a big picture about where in the brain the stroke is, because we know the left side of the brain controls the right side of the body.
Right.
So a lot of the people in our programs have aphasia, which is a communication or language disorder that happens as a result of stroke. So they know what they want to say. They just have a really hard time finding the words.
Yeah.
So a lot of the people in our programs work on aphasia. And so for them, the stroke was probably in the left side of the brain where the language is. And then they most often have a right side that's weaker. Of course, the opposite happens too. We have folks that had strokes on the right side of the brain, so their left side is weaker. And those people would be more likely to have changes in their cognition or their memory, their thinking skills. But regardless of where the stroke was or what kind it was, we have programs available to help them. And we also encourage people. It's never too late to ask your doctors those questions. They should be able to, look in your medical record and give you that information, whether that stroke was, 2 weeks ago or 20 years ago. It's important to know what's happened within your own body.
For sure. I'm glad you mentioned that. Yeah.
Yeah, I say, and certainly if it was TIAs, we take those very seriously. So I'm glad for you to hear you say the same, that they are warnings.
I find that a lot of people have them, and then once they are able to regain normalcy of their lives, then they just forget about that aspect and don't address it. So
Yeah.
the Stroke Comeback Center, when you guys have people who have TIAs, is there anything that you do possibly different from the ischemic or the hemorrhagic types, or is everyone?
Not necessarily. I mean, most of the time with a traditional TIA, it means that the symptoms will often resolve very quickly.
Right.
Sometimes if somebody has had multiple TIAs or history of them, there can be some lingering subtle symptoms and subtle changes that we would address through our group programs. But we definitely encourage people when they've had a history of TIAs to have good conversations with their doctors. Make sure their blood pressure, their cholesterol, and their diabetes, if that's relevant, are well controlled. We've had several people in our community that have come to us for a variety of reasons. One I spoke to just recently who was making a donation on behalf of a family member and said that she'd had a TIA 10 years ago. And she said it was a big wake-up call. She changed her lifestyle. She exercised more. She became healthier. And, she is so thankful that she had that warning. So it's important.
For sure. I so agree. I'm glad you mentioned that in terms of blood pressure and nutrition wise, because those are things we can modify in our own lifestyles so that we can avoid having a stroke possibly.
Absolutely. There's a lot of research out there that gives you a percentage of strokes that are preventable. And in a lot of cases, strokes are preventable. However, most people don't take a good look at those risk factors until after a stroke has happened. And then in which case, they don't have the opportunity to prevent that stroke. So being sure that, again, it's blood pressure, cholesterol, and diabetes are well controlled and can make you as healthy as possible to reduce your risk for stroke.
For sure. And then before we even have one, or we are seeing someone who possibly has one, it's good to know the different ways to identify one. So I just wanted to make sure that we're all clear with that. So being able to catch a stroke in action, you can remember the acronym FAST. Looking at the person's face, asking them to smile if there's any drooping or asymmetrical parts of their face. If you look at their arms, you ask them to raise their arm, and when it's dragging, you want both arms to be equal when they're up. The S would be asking them to possibly say their name or a different phrase and listening for either slurred speech or just if the speech doesn't sound correct or sounds
Mhm.
strange to you. And then T is the time. It's so important that you get someone to the hospital as soon as possible because
Mhm.
they can provide TPA, which is a clot busting drug. If it's given within the first 3 hours of the person actually having the stroke, the effects, the things that I see, your rehab needs will probably be diminished.
Oh, it makes a dramatic difference the sooner
Definitely.
somebody gets medical care.
Hmm.
And it's important. I'm glad you have in there T for time, call 911.
Yes.
As soon as somebody calls 911 with the thought that it could be a stroke, it starts the clock on a stroke protocol.
Hmm.
And in the DC area, we are so fortunate that we have so many great primary stroke centers in our hospitals around here. Um, and when the ambulance arrives, you're immediately at the front of the line at the emergency room. So we hear from families who say they got in the car and either tried to drive themselves or tried to drive a family member because you're not sure what's happening, and if it
Right.
ends up not being a stroke, they didn't want to call the ambulance unnecessarily. But overwhelmingly, the message should be: if you think it could be a stroke, call 911.
Absolutely. Yeah.
Yeah.
I'm glad you mentioned that because there are so many times we want to avoid the ambulance fee, so we try to
Mhm.
drive ourselves to the hospital. But being in an ambulance can get you in faster and get that
Mhm.
medication in your system enough to reduce having those effects. So thank you for mentioning that.
Sure.
Yeah.
Yep.
So I think we have a few comments over
Mhm.
here. Let's see. If you had a stroke and no paralysis, are there residual effects that may never ever cause any more problems?
Um, there can be all kinds of residual effects of a stroke. There certainly can be changes in cognition, as I mentioned, so your thinking skills, your language, your communication, and then you can have those changes and not have any paralysis. You can also have paralysis or weakness and not have any of those changes.
Hmm.
One of the other residual effects that I do think that we see often is just a change in endurance that people have. It takes a while to bounce back, and
It
even
does.
if you don't have really obvious changes, people just find that either their cognitive, their mental endurance, or their physical endurance takes a while to build. And that's why it can be important that if it's your physical endurance, even if you're not, and you can speak to this better than I can, even if you're not needing structured physical therapy,
Hmm.
to make sure that you're building your physical endurance so you can do those things in life that are important, like take a long walk with your family, even go to the mall and walk around with your family.
Right.
Same thing with the cognitive endurance. It's hard on our brains to go to work for 8 hours a day. And so building back up to that point that your brain can work and get through a regular workday can take a while too.
Hmm. Very true. Let's see. Thank you. All right. Brandon says, why isn't there a cure yet for strokes?
Oh gosh. I have always said I would be happy to find a new career if strokes could go away.
Hmm.
if there could be a cure for strokes and a cure for aphasia, the language disorder that I work with most often, then I would be happy to find a new career. My guess for why there isn't a cure for strokes yet is because strokes happen for such a wide variety of reasons. That it would be hard to work backwards and find a way to prevent them all. We do have great treatments for stroke now. As you mentioned, the TPA, the clot buster, that makes a tremendous difference. But even that only works with some strokes.
Hmm.
And that's why it's so important to get to the hospital at the right time so that they can do the assessments so that they can find out if you're a good candidate for that treatment. Because that's an example of one that is not one size fits all. They can't just automatically give it to everybody, because if they give
Right.
it to the wrong person, it can make things much worse.
Mm-hmm. Very true. Okay. Let's see. In your classes at the Stroke Comeback Center, can you give us like an example of one of them?
Oh, sure. So right now, between our 3 centers, we have 68 classes a week. I mean, it's amazing. And we do all of our work in small group classes. So our classes have, most of them have no more than 6 people in it. And people sign up for a class, and they're in that class for 9 weeks. We do 5 9-week sessions a year. So people get to really know each other. And then we have classes that are for people that have very, very, very mild changes after their stroke. So if you met them, you might not notice they'd even had a stroke, but they feel it. They feel like something is different.
Right.
And then we have classes that are all the way to people that have very significant changes after a stroke and need a lot of support with communication. So within that wide range of classes, we have some that are very discussion based. We have current events discussion groups. We have book clubs, lots of book clubs where you do whatever you need to do to read the material, get through the material throughout the week, whether it's an audiobook or read a book or both at the same time. We love that strategy. And then you come in and you talk about the book. We also have structured groups that work on just, say, memory. We have ones where you watch a TV show and you come in and you discuss it. So we have a wide range of topics for our groups that are at all different levels. But regardless of the topic, regardless of the level, the goals for most of those groups are to improve either a specific language skill, like word retrieval, or to improve your writing, or to improve your speed with reading. Or they can also be cognitive goals like memory or organization or problem solving. So in addition to all those, we also have an adapted exercise class, and that's a virtual class right now, and an adaptive virtual yoga class. So we have fitness goals being met as well.
Awesome. That sounds like a well-rounded program.
That's what we strive for.
So we want to give you listeners an opportunity to contact and be a part of the Stroke Comeback Center if you are having a diagnosis of stroke. Are there any other requirements?
No, and in fact, having a diagnosis of stroke isn't necessarily a requirement. So we have people in our programs that have also had brain tumors, that have had other kinds of brain traumas. We have combat wounded veterans in our programs. Primarily, our programs are geared towards people that have changes in their communication or in their cognition or in their physical abilities after we say a stroke or other brain trauma. Okay. So even if you haven't had a stroke, but maybe you're experiencing a lot of the same symptoms because of another kind of change to your brain, you're welcome to give us a call.
Okay. It looks like we have some new people joining us. So if you're here and you have a question, please put your question or comment in the comment section and we'll answer it. Thank you all for being here and for engaging with us. So is there anything that you think most people do not know about strokes that you would like for them to know?
Yeah, certainly. 2 things come to mind. First of all, when people think about strokes, they think about old people. And when I say that I work at a stroke center, I know that a lot of people think that I must go to work and there are a lot of old people in wheelchairs there. And that couldn't be further from the truth. Strokes happen at all ages. They happen regardless of education or socioeconomic status or profession. We have a cross-section of everybody in our programs. And our average age is actually about 60. So it's a lot younger than some people would think. And we have people as young as their 20s. And of course, we have people in their 80s and 90s that are in our programs too. So when you think stroke, don't automatically think it's something that only happens to the elderly population.
Exactly.
Yeah. And then the other thing that's a misconception about stroke is that progress ends. And we believe, those are fighting words around Stroke Comeback Center. Yeah. Does everyone make a full recovery? No. But do people continue to make changes? Do they continue to recover? Do they continue to find new ways to do things? And does the brain continue to heal? Absolutely. So we always say there is no stop sign on the road to recovery. So that's why it's so important that people find new ways to keep addressing the things that are important to them, so that they can continue to make those changes and continue their recovery indefinitely.
That's great. I think a lot of us think that after we get through an acute phase of having a stroke, that there's nothing that can be done. But that's not accurate at all.
No, and it makes us so mad when people say
strokes, right? And yet they're still making progress, still meeting goals that they had set a while off that they're now able to achieve.
Absolutely. Yeah. When people talk about the plateau in rehab, that gets people at Stroke Comeback Center fired up.
Yeah.
I mean, it's sometimes things slow down, and sometimes it's really hard to see changes, but it often means it's time to do something different. So shake things up, try something harder, try something that's, working on a different skill, look at something in a different way. But as long as the person is motivated and the services are available, recovery continues.
That's true. And I just want to add a caveat to that, because a lot of times we think what insurance will allow or what insurance will cover is it, right? And so progress can be made gradually. It can be made a little slower on the gradual platform. As long as you're moving forward, everybody doesn't have to go up the ladder.
Yes.
They're going forward.
Yeah. And I do think a lot of benefit can come sometimes from taking a break.
Oh, yeah.
And I mean that as a speech language pathologist when I was working in a medical setting. And I mean that's working at Stroke Comeback Center, that a break can be very helpful as a reset. Gives you an idea to see what you can do when you're on your own. And when, there's something new that you want to work on, it gives you a great opportunity to go back to a rehab program. And whether that's outpatient rehab or private pay rehab or something like Stroke Comeback Center, those breaks are like a vacation, and we all need vacation.
Oh, that is so true. I'm glad you mentioned that. Breaks are definitely important.
Yeah.
Looks like we have a few more questions over here. Okay, so what are the symptoms of stroke?
So the primary symptoms of stroke are the FAST acronym that you mentioned earlier. So changes in face. If one side of the face looks different from the other. Weakness on one side of the body. Usually in the acronym, we talk about arms. It can also be legs. Changes in speech, either the clarity of speech, the ability to think of the right words, the ability to put the words in the right order. So changes in the speech, but there also are some other symptoms too. So there can be changes in balance and changes in vision. So, and changes in the eyes. So sometimes we use the acronym BFAST. So balance, eyes, face, arms, speech, always time as the last one. But a lot of times we do use the acronym FAST because those are the most common. And then the shorter something is, the easier it is to remember.
That's true too. Okay, let's see. Hi, Ms. Watson. Discuss aneurysms and TIAs. My daughter has had 5 unruptured aneurysms and stroke-like disabilities as a result. No treatment, just watching.
Okay, so an aneurysm and TIAs are all kind of in the same family with stroke. So when something changes to disrupt the blood flow in the brain. So an aneurysm is like a little balloon that can happen on a blood vessel. And it sounds like in your case, the unruptured aneurysm, that's good. We certainly don't want that balloon to burst and become a ruptured aneurysm. Then it's very similar to a hemorrhagic stroke. And that's why I say some people come to us with all different diagnoses. So the most important thing in a case like this, where they've had multiple unruptured aneurysms, we know something is changing in the blood flow of the brain. So I'm hoping that they're getting good medical care to keep an eye on those aneurysms. They might go in and repair them, or sometimes they go in and can put basically like a filler to block the aneurysm, or a clip to repair the aneurysm. But when those things happen, because the blood flow is different than it would be in an otherwise healthy brain, there can be symptoms that are similar to a stroke.
Mm-hmm. I would just add, I know that there are so many benefits to changing your diet. Just because blood really should flow like water through your vessels, right? If it's thick or if the vessels are narrow, then that blood vessel won't push that blood through the way it needs to in your brain. And what we eat, a lot of things that we talked about before are modifiable things that we can do. And so making sure that we are not eating things that clog our arteries, not eating things that are high in fat content. Those things are beneficial to making sure our vessels have a healthy chance.
Absolutely. Yeah.
Hi, Miss Jillian. It looks like, okay, she has a follow-up comment. 3 repaired, 2 more developed over 10 years. Interesting.
Yeah.
Okay. Let us know if we answered your question too. And if you have any follow-up ones, you can add those to the comments.
Yeah. And sometimes when I was saying earlier that a certain percentage of strokes are preventable, sometimes things like aneurysms, that can just be, that the way that body is. It wasn't anything that they did or didn't do. It's just the way the blood vessels in that brain developed.
Yep. I have a patient right now too that has an aneurysm that is just being watched as well. Making sure that they take the proper diet, that they're not doing any strenuous activities. I think you mentioned stroke-like disabilities are occurring. So if you want to elaborate on that, possibly we can talk about it further. But thank you guys for watching. If you have any other comments or questions you want to talk about stroke with, please add them in the comments and we'll answer them. But while anybody is doing that, do you have a final thought you want to give us?
Yeah, well, I just want to tell you about this big upcoming event that we have. World Stroke Day is October 29th. Okay. And we have the Stroke Comeback Trail in honor of World Stroke Day. And it is a virtual event that is happening October 28th through 31st. And it is an opportunity to bring stroke awareness into your own community, because it can happen anywhere. Last year, we had people in Hawaii, we had people in California, all across the country. You can create a team and bring people together to bring stroke awareness and stroke support to your own neighborhood. And you can certainly, and we welcome it, do it in honor of a stroke survivor that's important to you in your life. And all of the proceeds from the Stroke Comeback Trail help support our programs. And most importantly, I mentioned this at the beginning, we do have a scholarship program. It's an important part of our mission that no stroke survivor be turned away for inability to pay. And so all of our fundraising efforts help support the ability to bring services to all stroke survivors who need them, regardless of their financial situation.
Awesome. Okay. October 29th, World Stroke Day.
Yes, and so you can do the virtual, it's a virtual 5K run, walk, roll, get it done however you want to get it done. If that's, 25 trips around the block, go for it. Okay. Or we have an option of a 1 mile survivor course too.
Awesome.
Also virtual.
Okay. Let's see. I'm going to pick this one up because it's a follow-up. She has ataxia on the left side and slight slurring, optical and auditory deficits. Aneurysms are near the optic nerve. Yeah.
Yeah. So I would hope those are very stroke-like symptoms. So I would hope she's getting support from some rehab professionals. I mean, that right there looks to me like PT, OT, and speech, all three.
Mm-hmm.
And if she's in the area and interested, those are also all diagnoses that we work with at Stroke Comeback Center in the context of our programs as well.
Yeah. So please let us know if we can help her any further.
Mm-hmm.
All right. Is Bell's palsy a form of stroke?
Good question. No, but it really often looks like it, especially when Bell's palsy first starts and someone suddenly has drooping on one side of the face. And that's an example of that happens suddenly. You need urgent medical care. If you think it could be Bell's palsy or it could be a stroke, I would rather say, let's start with thinking it's a stroke, and it would be a great relief if it's only Bell's palsy. So Bell's palsy is an inflammation of the facial nerve. Mm-hmm. So it is just usually one side of the face is weak, and it resolves. And you may know more about why it happens, but oftentimes they don't know what triggers Bell's palsy.
True. They don't often know what happens. If it's just your face that's paralyzed, you can see a PT and mm-hmm. get exercises to improve the strength of your side of your face that has been paralyzed. It usually does resolve pretty quickly with those exercises. If you are finding you have more global, or it's not just your face, but also your arm, your leg, that's more of a reason to go to the emergency room.
Yeah. Mm-hmm.
Oh, let me not skip you, Jillian. Do you have any good resources for patients? Is there a link for the stroke awareness event that you're talking about?
Yeah, absolutely. On our website, which is right there, strokecomebackcenter.org. You can, it's right on our homepage. Stroke Comeback Trail is over on the left side, and that will take you to all the information about the Stroke Comeback Trail event.
Yes. And do you want to mention like signing up for classes, how you can do that too?
Yeah. So also from our website, there's a lot of information about how you can join our programs. You can see all of our current class schedules. We have so many classes, we would never expect a family member to be able to pick the right classes. So the first step in joining our programs is to do an intake meeting. And that can either be done in person at our Vienna or Rockville centers, or it can be done virtually. And then during that intake meeting, it's a chance for the survivor and their family members to sit down with one of our professionals. We talk about their goals. We talk about what's important to them in terms of their interests. And we do a little bit of work so we can make some recommendations about which of our classes are going to be at the right level for them and that are going to help meet their needs. Also, once someone does the intake meeting, they're a part of our community, which gives them access to our family and caregiver support meetings that we have twice a month. We have 3 or 4 times a week. We have free Zoom social events. And then we also have lots of other social events throughout the year. So all of that is on our website, but you can also always just give us a call at the phone number you have there. I'm always happy to talk with families that have questions about whether or not our programs are right for them, or if they are looking for other resources for stroke in the DC area. We're happy to answer questions about that. Back to the question about resources, there's also a section on our website of helpful websites that we like. So if you're looking for, yep, I'm from Stroke Comeback Center. If you're looking for information, more information, say about aphasia, the language disorder, we have links on our website to the National Aphasia Association and information about stroke organizations in general. And I'll say we're very particular about who we put up there. So we only have organizations up there, most of them national organizations that we endorse.
Got it. Okay. So is there anything else that you want to share?
I think that's about it. I would just say the hardest thing about my job as executive director is getting people to know that we're available. So if the folks watching this, if we're relevant to them, that's wonderful. Give us a call, send us an email. But maybe you know other stroke survivors today. Maybe you know them. Maybe you're going to run into one down the road. Maybe somebody that you know is going to have a stroke down the road. But just, please know that we're here. We're a resource. We're so fortunate. That we have one here in the DC area. There are only a handful of centers around the country. So we're so lucky to be here in DC. And so we just would appreciate people spreading the word about us so that we can help all those who need us.
Great. Now, I just had a follow-up question regarding professionals or other rehab therapists or anyone else who wants to refer to you. Is there anything we need to do in particular, or should we just direct people to your website as well?
Yeah, you can just direct people to our website, or if they're not techie people, just give them our phone number, and we'll take it from there. The nice thing about being a nonprofit and working the way we do is that we don't need doctor's orders or insurance information or any of the procedural hiccups sometimes that happen. So people just give us a call and we'll take it.
Well, I so appreciate your coming tonight to talk to us about strokes in general and how the Stroke Comeback Center can help you along your path, especially since we know living with a stroke is a chronic thing. You don't live with it and it goes away.
Yeah.
So thank you so much for joining us, and thank all of you all for watching. Of course, every time we do a pull up with Limbs and Things, it's to confirm something you know, challenge something you don't know, and give you an opportunity to share that information with someone else. We hope we've done that tonight. I hope you have gained some information that you can possibly share with others. Thank you so much, Ms. Coyle.
Thanks for the invitation.
Sure. Everyone have a good night.
All right.
Bye.
Bye.